Hi mama, if you are afraid about tearing and the idea of taking care of your stitches in the postpartum period, well, you are not alone. So let's go into the video to know what can you do to speed up your recovery during your postpartum. Welcome back to my channel. My name is Ilenia and I'm a midwife with a passion for empowerment and education during your pregnancy, birth and postpartum journey. Today's topic is really about the postpartum because a lot of women receive a laceration and a tear during childbirth and therefore require stitches, or even if you didn't get stitches, you still need to mind your perineum. And you're not alone, so this topic should not be a taboo. Up to 80-90% of women receive a tear and therefore some stitches after birth, and that is something that we need to care about and look after to make sure that we can speed up your recovery. So, having pain and feeling sore and tender in the perineal area after birth, it's normal. But this doesn't mean that you just need to go ahead and bear it and without doing anything. There are things that can be done to help you to soothe this pain and to reduce it. So let's go and see them together. First of all, you want to keep the area nice and clean. The cleaner and the drier it is, the sooner it's gonna heal. The stitches are done with a thread and a material that dissolve itself, so you don't need to come back to the hospital to have them removed. It's just gonna dissolve by themselves, usually within 7-15 days. So there's something that you can do to help this process and to speed up the healing of the stitches. So make sure that you keep the area nice and clean, as I was saying. You want to use a lot of running water in the area, so at least a shower a day, but also there are those kind of bottles that you can use when you go to the toilet, like they're called peri bottle. I'm gonna link them down below because they're very good, and you want to make sure that even when you pass urine, you just get a lot of flow and clean water in the area. This is because it's gonna help to wash the old blood or even the rest of the material that your uterus is getting clean from. So you want the area to be very clean and able to get fresh air and be dried frequently. So make sure that you don't rub it, but you gently pat it, and that you change your pad frequently. Change your pad every few hours, even if it's not completely full. Just make sure that the area is full of oxygen and fresh air and that it's clean and dry. This is gonna usually improve the recovery and reduce the chances of infection. Another great tip, especially if the area feels very swollen or edematous, is actually to use ice packs. We never want to put ice directly on the skin because it can actually cause severe damage, but you want to wrap it around a towel or a cloth and just put it on the area, even outside of your clothes or your nightdress, and then try to keep it there as long as you can bear it. Another thing that you want to do is to don't sit on your stitches a lot. So especially if you're breastfeeding for a long time, try to breastfeed side lying so that you don't put a lot of pressure on the area, or even if you're sitting, try to change position often or use a pillow or a cushion to just help to don't put a lot of pressure in that area. You also want to avoid to wear tight clothes and like tight jeans or tight leggings to make sure that the perineum has a lot of space and area and a lot of air circulation to heal properly. You want to have a diet that is rich of fibers and water to avoid constipation. That's very important. You can even use some laxative if you are usually constipated during life. This is because you want to avoid straining when you're sitting in the toilet. So you want to keep your stools soft, so that is way more easier to push them out. You can also use a squatty potty, meaning a stool to lift your legs, just to facilitate especially the first trip to the toilet, that it can be super scary. Some women will also need to kind of hold their stitches with a pad or with a clean toilet tissue, just to help the sensation of kind of tearing again when you go number 2 for the first time. So feel free to do it if that is something that helps you, especially mentally. You want to help your recovery by taking pain relief. There are pain relief that you can take at the hospital. You can ask what are safe to take if you're breastfeeding, but especially for the first week or 2, don't be afraid. Take some pain relief because it's going to help you a lot to bear the pain during your daily life activities. These tips are generally referred to first, second degree tears and episiotomy. If you have not seen the video where I talk about differences between these tears, make sure you check that out. But generally speaking, although the healing process can be different, the way you care about these stitches is quite similar. If you had a third or fourth degree tear, then you want to add on top of these tips extra care. They might, in the hospital, they might prescribe you some laxatives and some oral antibiotics to make sure the area doesn't get infected. And then you also need to be referred to physiotherapy just to make sure that you can get those muscles function back to normal. This links me to the last tip that I want to give you, pelvic floor exercise, that are super helpful even if you had a first degree tear or even if you had no tear at all, because you want to bring back that muscle functions as soon as you can and to train the muscles again to prevent any type of issues such as incontinence or prolapse during your life or even in your late life. Having urine or fecal incontinence can happen in the first days after birth. But don't keep it for yourself, thinking that is normal and thinking that is gonna solve by itself. You want to speak to your midwife. If you're still in the hospital, she's gonna link you to a physiotherapist. Or if you are at home, just make sure you address this issue in the community with your GP or your local midwife, just because you don't wanna let it go too long. But you want to address it as soon as you can to make sure that something can be done. Otherwise, if you don't suffer about incontinence, you can start doing your pelvic floor exercise as soon as you feel ready. I will probably leave it the first week or 10 days, but then when you feel ready to do it, then start to train back your muscles, because the sooner you do it, the better they will get the memory back about their function and to get reinforced and strong again. There are two different exercises that you can do, even during pregnancy, but especially during the postnatal period. The pelvic muscle are all linked together, so they're the same muscle that help you to pass stools, pass urine, and also close and open the vagina. So they're all linked together. You can do this exercise while you're laying on the bed or on the sofa with your bladder empty. So don't do them on the toilet like someone might suggest you. You want to be nice and relaxed with your bladder empty, and you want to start to close the back passage as if you are preventing wind going out. You want to close the anal sphincter and then going up, closing your vaginal canal, and then closing your urethra, which is the hole where you pass urine. You want to try to do it quick for 10 times. You want to do it 3 to 4 times a day. The second type of exercise is the same one, but you actually want, instead of doing quick release and contract, you want to hold the muscle tight for up to 30 seconds if you can. At the beginning, you're not going to be able to do it for that long, but keep exercising it just so you can really lengthen the time that you're able to contract your muscle. So the same way as you were doing before, you want to close the anal sphincter first and then going up, and you want to hold it as much as you can. If during your postpartum journey you smell like the odor of the stitches is not right, if they get sore instead of getting better, or if generally if it's very swollen and sore, then make sure that someone can have a look on your perineum and your stitches, just to make sure that they're not getting infected or they're not getting worse for some reason. That's all for this video. I hope it was helpful. Please do make sure that you look for professional advice and professional care if there is something going wrong with your postpartum recovery, because you really need a midwife or a doctor or someone that is really specialized in pelvic floor recovery, just to make sure that you don't leave the problem be, but you really get addressed as soon as you can, just to go back to your normal life. If you have no problem with your postpartum journey, that's great. Do make sure that you follow these quick advices just to have a smooth and easy recovery. I'll see you next video. Bye bye!